Hi everyone, I'm Janine Lasant, your host today, and you are watching Skin Sense right here on SSP TV. Today we are going to touch on the safety conditions here at DermDox during COVID-19 2020. I'm with Dr. Steven Schleicher here at DermDox, and again, we're social distancing, that's why we don't have our masks on. But here at the office, things have changed in 2020 due to COVID.
To put it mildly. And actually, this is the first show we've done since COVID, right?
Yes.
So it's been a little bit of time. And it's not only our office, it's the world, okay? The whole world has changed. And a lot of people are afraid to go out, okay, as we talked about previously. It's frightening. From a medical office standpoint, now I have 6 offices, okay? So just opened offices up in Bethlehem and Gilbert, PA. And during the peak of the crisis, people may not be aware, but Hazleton was a hot spot. Okay, so this is the only office. We actually closed for about 4 to 5 weeks because the hospitals were filled with COVID patients, and it was really, really scary. We couldn't subject our workers to that type of environment. Things loosened up. We're obviously back at work. We're seeing patients virtually 5 days a week. And patients have really overcome their fears about going to doctors. People are out. I mean, I'm driving around, going to the supermarket or whatever, and there's tons of cars out. So people have, kind of lost their fear of going out, which could be a good thing and maybe a bad thing for some people.
Is it that they lost their fear, or that they just don't want to lose their mind because staying home for this many months, we have to also worry about our mental health? Yeah,
it's really, really tough. And it's tough for, not only doctors, their patients, but, people in general. And holiday time coming up, I just worried for people getting, depressed because first time ever in my life, I'm not going home for Thanksgiving. You can't. It's out of state.
You got to watch with the restrictions on what states, every day I actually look and see what states we cannot travel to, and they are up to about 25 to 26 states at the time of taping this show. So for your patients, so that people know, the office is open. If you do have things that you need to be treated medically, you need to take care of that and not be afraid to come into the office because you are taking steps to protect them against the disease.
So,
that's something we should talk about and let people know. If you have a condition and it needs to be treated and you're on medicine, you need to come in and see the doctors.
Right, and we basically practice strict guidelines, okay, mandated by really the medical societies. So of course everybody wears masks and the cleanliness, we clean all the time. But what you said is very, very important because people are neglecting their health out of fear of going out. And some people are actually dying because they're not getting checked. And we see skin cancers that are neglected. By all means, if you have a skin problem, yeah, we're here. We're here.
Okay, so again, the office is open. DermDox, located in Sugarloaf, right off of Route 93. You can call the office. You can talk to someone here about the safety standards about waiting in your car. You will be safe. You will need a mask. It is sanitized here at DermDox, and you can get all the information by calling. When we come back, how is COVID affecting health here with skin conditions, and what are they doing to treat conditions that deal with COVID? You're watching Skin Sense right here on SSP TV. We'll be right back. And Dr. Sara Mahmood joins us now. She is a podiatrist. She is here working with Dr. Steve Schleicher. This is an unusual condition because I believe this is the first time you've had doctors in with you during COVID.
Well, yeah. I mean, we've always had podiatry fellows.
Sure.
Okay, but it's totally different now with COVID, and coming up we'll actually meet some physician assistant students whose lives have been totally altered by the experience. And of course, with Sarah too, you know, she trained before COVID, and now she's here during COVID.
Yeah.
Okay, and Sarah, maybe you could just tell a little bit about your training, where you're from, and.
I went to undergrad in Maryland, did my residency in Baltimore, so I'm kind of new to the area, but, and then the transition in the pandemic was kind of a new experience. But being a fellow here at DermDox under Doc, you know, we see all sorts of pathology, and one of the, I guess, the most interesting things we've seen so far is the phenomenon known as COVID toes. A lot of people might not be familiar with it, but what it is one of the dermatological manifestations of the COVID-19 virus. So what it typically is seen in young adolescent patients, and it will present as these red, purple, or bluish, what are called macules or plaques. So their toes or their fingers can, you know, have these reddish, bluish, purple discolorations. The thing is that the disease process itself is self-limiting, meaning it will resolve within a matter of weeks without having needed to be treated. But the theory behind is that this could actually be a response to the virus itself, meaning that the virus is somehow causing some sort of a hypercoagulable state in these patients and is presenting as them having some degree of acral ischemia in their digits.
Yeah, so if we see somebody with red feet, red toes, or purplish feet or purplish toes, we never used to think of COVID, okay? But now, one of the first things we think about is COVID, and we say, you know what, I think it's a good idea if you get tested for COVID. Usually they're asymptomatic, which means unless you look at it, you don't even know you have it. Okay, it's not usually painful, can be on rare occasions, can be itchy on rare occasions, but it's one of the manifestations of COVID, which there are other manifestations too that affect the skin. For instance, hives. Hives are very common. But in the beginning of the COVID outbreak, I saw a couple of patients with hives who, in retrospect, I said, boy, you know, I should have tested them for COVID, but nobody knew that in the beginning. It was just later on we realized that can be a manifestation of COVID. People can get like these rashes, faint rashes, that nobody really would even associate them with anything other than some common virus, but now we always think COVID.
Now, do you think we know, we're still learning about this disease? Do you think this will be, you know, maybe a year from now we'll even know even more about the disease and things to look for? Because I'm sure it's here to stay. Even if we have a vaccine, it's like the flu, it's still here. Yeah,
it's here, and it's actually just a bad virus. I mean, the flu virus we lived with for, you know, basically centuries. It just came upon us, you know, last February, and we're just totally, no idea how to, we still don't have any idea how to deal with it because we still don't have a vaccine. Sure, a drug was just approved for treatment. It doesn't work that great. So the key thing is protect ourselves when we go out, we wear masks, we wash our hands. But as you know, we said, there's just so much you can do, and people are getting tired of becoming hermits. So, but by the same token, you hate to see on TV parties or block parties that people are having and super spreaders out there, you know, so we just have to weigh the pluses and the minuses and really hope there's going to be a vaccine and more effective treatments.
Is it, you know, your focus is a lot more on just the disease, or how has it changed?
I feel like we're definitely becoming, because I feel like initially when the pandemic initially started and patients were seeing these discolorations, I feel like, you know, people weren't being as vigilant, and I feel like these COVID toes, you know, pathologists have actually looked at what happens to the vessels, and they have what's called endotheliitis, meaning inflammation of the vessels. And patients that have COVID have that inflammation in other organs as well. So I feel like it's something that cannot just be dismissed, that, oh, you have, you know, like a pseudo-chilblains type of reaction, your toes are just changing colors because of the inclement weather changes. It's actually inflammation that, you know, we've seen in COVID patients in their other organs as well. So I feel like it's made us, or me in particular, more vigilant that, you know, things like that could not be dismissed. And, you know, if we see something that even raises our suspicion a little bit, we educate the patient and tell them to get tested to make sure that, you know, we are able to come to a definitive diagnosis
That's a real
and
good
help
point.
them.
Who would think a podiatrist or dermatologist would be the first people to diagnose COVID, right? I mean, who would even think that? But now, yeah, virtually every specialty is aware that it can look different and it can present in many, many different fashions. And even the disease itself. Some people get headaches with it, some people get diarrhea with it, some people get rashes with it. The virus is really peculiar, and it's just bad. It's just a bad virus.
The uncertainty of how it can affect you, it doesn't discriminate by age or by race or by gender. It can affect you where you have no symptoms, or it can affect you where, God forbid, it could take your life. So there are so many variables and so many different things and so many symptoms. Aside from COVID, there are other things that you treat with the feet that we want to talk about.
Absolutely. One of the most common pathologies that we see in our office almost on a daily basis is what's called onychomycosis. What that is an fungal infection of the nail unit itself. So when a patient comes in with something like that, typically what we notice is that significant thickening of the nail itself. They will have what's also called subungual debris, meaning they'll have a lot of collection of just debris underneath the nail. They tend to have, even though the nail is hard and thickened, but it tends to be brittle at the same time. So they'll suffer from a phenomenon known as onycholysis, meaning the nails will tend to be brittle and break off on their own. So the diagnosis is most common a clinical one, but we have in the past, we're always able to send a specimen of the nail for special staining and fungal cultures to help us come to a diagnosis. And most commonly it affects adolescents, but we see it in all age groups. And a lot of times when patients have these fungal toenails, they will also have a concomitant, some component of what's called athlete's foot or tinea pedis, meaning the skin on the bottom of the foot will have some degree of flakiness. In between the toes, they'll have what's called maceration, meaning the skin is extra moist. So by the time the patients come into our office, you can safely assume that they've kind of already exhausted their over-the-counter topical medications. So yeah, there are topical treatment options are out there, but I always ask them that, hey, what have you done in the past? What has helped? What hasn't helped? So one of the newer treatment plans that we have here at DermDox that I learned from Doc is that there was significant controversy in how to treat toenail fungus. So one of the major oral medications that we use for toenail fungus is metabolized by the liver. So back in the day, there's an issue with compliance and being able to prescribe it to patients that have liver disease. But with the current literature, it has proven that this actually is a very safe and effective drug. And the way we prescribe it is that we put the patient on the medication for 10 days, and then they're off of it for 3 months. So it's called a pulse therapy. So when we pulse them, we are sending a high concentration of that drug to kind of address their problem. And even during that off period, the literature has shown that the medicine can maintain its efficacy for up to 30 weeks after they last got their dose. So again, we pulse them for 10 days, we see them back in 3 months and look at the progression of their disease. And I've noticed that it has helped a lot. It keeps it simple. From a clinician standpoint, it's easy for me to prescribe, it's easy for the pharmacist to dispense, and the biggest thing is that it's easy for the patient to be compliant with. In the past, it was a nightmare because they had to get blood work before they were on it. They had to get blood work every month when they were on it. Now it's a 10-day course. You're off of it for 3 months. Come back and see us in 3 months, and we've seen excellent results.
It's amazing the advancement with all this medicine and where we've come with certain things to treat. So again, you are here until, I believe, June?
June of next year.
All right, so come in and say hi to Dr. Sarah. Thank you for joining us.
You're welcome.
On the show. I don't think we need Doc anymore. I think it should just be you and me on the show.
Oh, thanks.
Sounds good.
Thanks for joining us. We have two.
Of course, she says that with every guest I have. You think I should start taking it personal or take the hint? I'm not sure.
We have two more guests coming up on the show. Who's going to be with us next?
Yes, we do. We have two physician assistants. One's a student, one just graduated. And we're going to talk about what it's like being a physician assistant during the COVID times. It's a whole different ballgame.
All right, stay with us right here on Skin Sense. Welcome back. You're watching Skin Sense right here on SSP TV. We are touching on COVID and how it has affected the medical field and healthcare in general with Dr. Schleicher. We talked about podiatry and how we called it COVID feet and how you have been treating that here at the office. But this has also affected your students who come in, right?
Absolutely. Yeah, and Zach actually graduated PA school, and he hopefully will be joining us in a few months, okay, as one of our physician assistants. And basically, obviously it's affected your life greatly.
Yes, absolutely.
Like everybody else. And actually, why don't you just tell us a little bit about your past, where you went to school, where you're from?
Sure. So, my name is Zachary Sabade. I grew up in St. Clair, Pennsylvania. I went to Pottsville High School, Misericordia University for my undergrad. Then I went to Chatham University in Pittsburgh for a master's in biology, came back to Misericordia for their PA program, and now here we are, graduated.
And how'd you get stuck with Doc?
The abuse I have to take on this show is
You're being
like,
way too nice to me on this show. I don't know.
Absolutely horrible. Like, this complex.
How did you end up here?
So I ended up here in my final rotation. It was my elective. I wanted to do dermatology. So they gave me this rotation. I had nothing to do with the placement. My previous class advisor said that she knew somebody who worked in dermatology. She set me up with Dr. Schleicher. And ever since then, I just vibed with the atmosphere, everybody in the office, everybody's so kind, and everybody wants to teach and see it's patient-centered care.
Yeah.
Everybody wants to see the patients get better.
When did
So
you start here?
I started in July, and I've been here since then.
So you're here all
yeah.
through COVID?
I was here, since July, yeah. We started trickling patients back in slowly, and it's picked up since then, so the demand is there for it.
Zach loves dermatology. Actually,
Yeah,
your program
always.
director called me up and said, we have this student who loves dermatology. Is there any way you can take him? And it was really, really tough because, number one, we take other students from other PA schools, from King's, from Arcadia. And number two, with COVID, you don't have the normal patient load. So, but because I knew her and she said the student was very, very interested in entering the field, I said, okay, we'll make an exception for Zach. And we did. And we're
And you're glad you did.
Oh,
Yeah.
it's truly a blessing in my life, Dr.
Yeah.
Schleicher. I owe you so
Well,
much.
it kind of balances me out, you know what I mean? Because
Is that even
I'm kind of impulsive
balance
and
you?
I'm so mean to the staff. And
You
all
are.
that, but yeah.
You look like a mean.
Yeah. So it's good.
Zach,
It's good.
tell our audience, maybe there's someone out there who's, in your shoes or they're going through the program. And I talk to these, kids, younger adults who are going through these programs right now. And it is a hard transition when you go from before COVID to now going through school through COVID. So any advice you can offer to these students as they, try to get to level that you are at with the rotations?
I would say be flexible. The only thing that's constant in life is change, and here we are. Life is flipped upside down. You have to get used to seeing patients over the computers, on Zoom, telemedicine. That's not something that we were ever trained in. You can't see in somebody's mouth or ears or check out their eyes over Zoom, but you have to start to be able to adapt to the changes and be able to see patients online. It's very different, but
And actually, a good thing about dermatology is you can actually see skin lesions. If you're a cardiologist, or of course you can do a remote EKG, but you can't do imaging studies and whatever, whereas derm, we're usually visual, okay? So if we look, the problem is if we look at something and we say, you know what, that really looks like it could be a skin cancer, what's the next step? Well, the patient then has to come into the office because you can't do a biopsy when they're home, and that's the only way you can make the diagnosis of a skin cancer. So, but it's kind of good in a way because more and more people are getting used to telemedicine, and who knows where COVID's going to end up. We have no idea how long this is going to go on for. And so, we're doing FaceTimes, whatever, with our patients, which I've been doing telemedicine since 1999. I was one of the pioneers in Pennsylvania. I do every state prison by telemedicine. Okay, so I have about 40,000 inmates who are my patients. And so for me, doing telemedicine was secondhand. But for everybody else, it's not secondhand, and especially for patients. We have grandmas and grandpas, and you're teaching them how to do Zoom and FaceTime. It's kind of funny and cute in a way. Actually, people are picking it up.
Yes.
So it's not, it's not something, it's really a necessity.
Yes, it is.
So it's not something, if you're sick, or if you have a really bad rash, or if you have a skin lesion that just doesn't look right, you want to get that checked. So if worse comes to worse, you do a FaceTime, you do a Zoom or Skype, whatever with your dermatologist, at least get it checked by the internet.
All right, Zach, thanks for joining us. We have another guest coming up.
Thank
Stay
you.
with us. We have a third and final guest with us here on Skin Sense. We have Kate Hull, and she is from King's College.
Yes.
And we're glad to have you on the program. Again, to shed some light on the program and to also, Doc, talk about how your experience has been here in the office and being here through COVID-19.
Yeah, and maybe Kate, you could talk a little bit about your background, where you're from, and did you go to King's straight from? Okay.
Yeah. So my name is Kate. I'm from King's College. I grew up in the Bethlehem, Allentown area. I did go to King straight through from undergrad, started as a freshman. They have a 5-year program, so I was lucky enough to be accepted as a freshman, and then went right through and am now in the graduate phase in my final year at the program.
Very nice. Well, again, a very good school to attend and very hard, very competitive to get in your freshman year.
Yes, yes.
So again, how have things been here with going through this rotation through COVID?
It's been great. I've had a great experience. Dr. Schleicher and King's has a great working relationship. And a lot of students have been able to go through with Dr. Schleicher, and I've been very blessed because dermatology is my elective again, and I'm really interested in it, and Dr. Schleicher is just the best. So it's a great hands-on experience. He lets me do a lot, lets me see my own patients sometimes, so it's really great. I couldn't have asked for a better rotation, honestly.
How has it been with communicating with patients? Maybe you have patients who don't speak great English. How has it been with the mask? Maybe you have people who have hearing conditions. Has it been a challenge?
You actually raise a good point, because a lot of patients don't speak English, period. And we have a lot of Hispanic patients. We have 3 gals in our office who are Hispanic, speak Spanish, obviously fluently, bilingual. And we've done an outreach to the Hispanic community, which I find to be very important. As we all know who live here, the tremendous influx of Hispanics over the past few years. Hazleton is really known for that. And if you don't cater to the people who live here, why should we live here? You know what I mean? So we've done a tremendous outreach. I'm sure you've seen many Hispanic patients while you're here.
Absolutely. I've done a couple of rotations in Hazleton and a lot of Hispanics, and it is difficult at times. It's difficult for them to hear us, and sometimes translations get messed up, especially with the mask, if they're hard of hearing. It just makes for a lot of different challenges, but I think that as healthcare, you have to adapt as best as you can to those circumstances, and I think this office has done a tremendous job with it.
What have you learned so far? It could be COVID related or not, as far as working in this office and actually working in your field.
I think COVID related is just to adjust. The best thing, and we're in healthcare, and that's the name of the game. Everything's changing. Everything is new. There's new drugs. There's new treatments. So I think just adjusting, and Dr. Schleicher is really great at that, being on telemedicine and being current with the times. I think that's really important.
What about worrying about your own health with being in the field that you're in now? You're pretty much used to it, but I mean, is it something that you're dealing with patients every day that might or may not have COVID or other contagious diseases?
Yeah, I don't think about it every day. I don't really think about myself. I usually put the patients number one. If they need to be treated and I'm the one to treat them, then I will treat them the best of my ability. So
yeah, you're probably safer here than say at your local grocery store. Sure. So everything is relative, and the world is scary, but you have to live too. So, but with you, it's so disruptive with the students, and as far as their rotations, maybe you can even talk about how disruptive, even with us, because we've had to just cut back our personnel, because I can't really double up with our physician assistant, because you have patients waiting in their cars. You can only put X amount of patients in the waiting room. So it makes it tough. And you've experienced that now already with what, 1 or 2 of your previous rotations?
Yeah. So my first rotation was actually online, because I started my rotations right in the middle of like the surge of COVID. So my first one was online, and then fortunately we have been able to go back. This is my second rotation that has been in person. So fortunately we've been able to get that, and fingers crossed that we're able to continue this trend and not have to go back online.
Yeah, can you imagine doing, learning medical education online?
I
dealing with
I
the
teach
patient
mass comm
face-to-face?
at King's, and my students, it was the end of, it was March, April, that we were, even online, and I said, listen, we're in technology, mass comm is in technology, and they were even, because it is change, but like you said, adapt with the change, and as Zach said earlier, change is the only thing constant. So again, if we want to reiterate that if you do have a medical condition, that you are seeking care, and that you are not waiting for this to be lifted, because who knows how long this could be.
Who knows? And actually, if you read the paper, there's been a number of deaths attributed not to COVID, but to people not getting medical care, like thousands and thousands and thousands. So, by all means, if you have something that you think may be serious, or, you think about trivial things, like if you have a bad eczema and you can't sleep at night itching, you want to be seen, because, we probably give you a shot or some medications and clear you up for months rather than living in misery.
Very good. Thank you for joining us on the program, and we wish you luck at King's. Also to Zach and Dr. Sarah. And Doc, thanks for joining us again for a new show here in 2020.
Thanks for allowing me to come back.
All right. You're watching Skin Sense right here on SSP TV. We'll see you next time.